Hello, I'm Dr. Shaylin Buck. In this DeKalb Medical Minute, we'll help you understand why it's important to get to the hospital as soon as possible if you or someone you love has heart attack symptoms. Let's hear more from Dr. Mirza Ahmed of DeKalb Medical's Heart and Vascular Institute.
It is absolutely critical for patients to come to the emergency room as soon as the patient's symptoms start. The sooner we begin the process of opening the artery, we can lead to better survival in these patients. The heart attack occurs when a clot forms on an existing blockage in a coronary artery. The window of opportunity is narrow, and opening the artery in the shortest possible time leads to saving heart muscle from dying.
DeKalb Medical is very proud of its rapid response time for heart attack patients.
A national registry tracks the effort of various hospitals to achieve the opening of the coronary artery in that first 90 minutes of the onset of their symptoms or arrival to the emergency room. And this is called door-to-balloon time. Well, DeKalb Medical offers 24-hour emergency cardiac services. We make an extraordinary effort to achieve those 90-minute door-to-balloon times, and our results have been comparable to the top 5 centers of the city, if not better. At DeKalb Medical, we have structured the program in a way that we have a team that stays on campus, so that if there is a patient that is suffering from a heart attack, can be immediately brought to the cath lab without wasting any time whatsoever.
The most common way for cardiologists here to open blockages is in DeKalb Medical's state-of-the-art catheterization lab with something called a stent or a medicated stent.
A stent is a metal mesh which is mounted on a balloon and is delivered into a coronary artery at the area of blockage. Once these stents are deployed, they can keep the artery from collapsing back and result in shorter recovery times. We offer advanced blockage openings with stents, and in most of our patients can go home in 1 to 2 days after the procedure, and certainly back to work very quickly thereafter.
If you or someone you love is having heart attack symptoms, get to your nearest ER quickly. Your life or theirs depends on it.